Hey everybody, I am joined here today with Dr. Michael McKay over at Trillium Medical Aesthetics. You can find him at michaelmckay.com, michaelmckmd.com. And so we're here to talk about his treatments for ED along with some of the main causes and questions that patients have. So doctor, thank you so much for joining us today. Really appreciate it.
Yeah, I'm glad to be here. Hopefully we can shed a little light on some of these subjects.
Yeah, absolutely. And yeah, I wanted to start off just by asking about, your experience working with these patients and what got you into these treatments, being able to help them with this.
Well, I live in Gulfport. I'm a board certified OBGYN, and I'm about to finish my 30th year of doing that. And one day, within a week, two ladies came in and asked me about the O shot.
Mm.
So I did some research and I found that the guy that invented it is just down the road from us in Fairhope, Alabama. And so I went and did the training, and sort of from there, it just evolved one step after another. And I've split time now between Trillium, which is my medical aesthetic clinic, and Premier Women's Health, which is my OBGYN clinic.
All right, yeah, well, that's awesome, and congrats on the career and the 30 years as well.
Yeah, it hadn't seemed to be that long, but it is.
Yeah, it never does. And yeah, I wanted to ask as well. I know with ED and these treatments, they're really not talked about very much between men and their primary care doctors very much. Why do you feel like that is?
It's a very, very sensitive subject. It's you're talking about our manhood, and if we can't be that man, then we're reduced to nothing. Well, we have a lot of treatments for that nowadays, so it shouldn't be a factor.
Definitely. Yeah, and I know for a lot of guys, they might assume that it's just something they're going to have to deal with as they get older. But I mean, with these treatments, you're really finding that that's not the case, right?
That's right. And we treat ED with the P shot, and the females have the O shot, but we also at Trillium do a lot of other things to make men more confident with helping them with wrinkles or skin issues or skin tightening, making them look a little more youthful. So there are many ways to make men feel better about themselves.
Yeah, well, it's great to hear. And with ED, what are really some of the main causes and reasons why, man might be suffering from that?
There's a multitude of causes, but there's three main things. Number one, you need to have a good testosterone level.
Mhm.
And our testosterone declines in our 40s and into our 50s, and it can be a big problem with our energy and our sex drive and so on and so forth, and how we feel. So number one, get your testosterone checked, and if it's under 400 or 500, get it treated by somebody that does that every day. The two physical aspects are basically getting enough blood flow into the penis,
Mhm.
and then having the valves closed to hold it in.
Mhm.
So you can either be not getting enough blood flow, or it can be leaking out through the bad valves in the tissue.
Mhm. Okay, and then is the P shot able to help solve those issues?
Yeah, the P shot can really help those issues. Let's talk about what the P shot is. The P shot is a injection of the penis with platelet-rich plasma.
Mhm.
And people will ask, what's platelet-rich plasma? Well, everybody's just about had blood drawn in a lab, and it sits there in the tube, and you see the yellow part go to the top and the red cells go to the bottom. Well, the top is the plasma.
Mhm.
If you centrifuge the plasma down, you'll have a platelet-rich end and a platelet-poor end. And the platelets have a lot of the growth factors, healing factors, stem cell attractants that will fix a lot of these problems. Interestingly enough, PRP treatments
Mhm.
came from veterinary medicine.
Mhm.
So they're real, they have the science behind them. They came from the horse racing industry. They were used to get the horses back on the track faster, of course, to make money. And then it moved over into the human medicine. And we not only use it for ED, but we use it for other things in the face, skin, joints. We treat a lot of joints also to make them heal and feel better. But most men, when we talk to them, they're like, "You're gonna stick me with a needle how many times down there?" And really, we keep that in mind, and so we give you numbing medication. We get everything good and numb. And most of the time when we finish, they'll tell me, "Yeah, it was much more scary than I thought it was going to be. It wasn't as bad as I anticipated."
Right. Yeah, well, that's good to know. The worst part's kind of that initial anxiety about it.
Mhm. And we've had really great success doing it. The people that are hardest to treat are diabetics.
Mhm.
Other people have high blood pressure or on certain medicines that may affect their blood flow and so on and so forth. Really helps them a lot.
Yeah, interesting.
And it's for most people, it's a one-time treatment, maybe once a year or maybe every year and a half.
Mhm. Okay, and so I know you mentioned that the pain's pretty minimal with it, not as bad as most patients are expecting, and then it's using the body's own natural healing process. So, is there any other side effects or anything else unwanted with it?
Well, you could get a little bit of bruising. You're sticking a needle in vascular tissue, so it's not unusual to get a small bruise or discoloration. But I really haven't had anybody tell me it was terrible. I've
Mhm.
never had anybody have any bad side effects or problems. And the main reason for that is you're using your own blood products. You're basically taking the body's healing mechanism, you're focusing it on an area, and you're concentrating it at a much higher level than your body can do by itself. So that's why you really don't have many side effects at all.
Yeah, that makes sense. And I know a lot of patients have tried like some of the PD-5 inhibitors. Is this more of a longer lasting solution, whereas those are more temporary?
Yes, that's exactly right. It's a more long-term solution to either be an adjunct to the drugs or really to get you off of the drugs and back to your normal spontaneous self.
And then I know with those are focused on, improving blood flow as well, even though it is just temporary. Do you find if somebody's taking those and, at least having some success, that it means they'll respond well to something like the P shot?
Yes, yes, you're exactly right. They do respond very well because the person that does not respond very well is not having an erection under any circumstance. That's a really tough one to fix.
Yeah, that makes sense. And so is there anybody that you would say is, specifically not a good fit for it? It sounds like, pretty much anybody that's struggling with it would be a good candidate.
I don't think there's anybody that really you should rule out. It's very little side effects, very safe. It's your own product, so literally everybody can at least try it. And some people get great results with one P shot, and some take two. And that's all I've generally had to do is one or two.
And how long do you typically find it takes before they start seeing some results and some relief from the ED?
Well, it's usually pretty quickly, even that afternoon, night, and for the next 6 weeks. We also combine a couple of things with it. One is exercise. We want to make sure you're getting good blood flow all over the body by exercising. And we also use a penile pump. And the reason for that is if you haven't been having normal, strong erections, some of that tissue has shrunk a little bit. So by using the pump, you stress the penis out, you force the blood in, and that way you're helping get all the stem cells and healing factors in from the PRP as well as your body. And we usually recommend that for the first 6 weeks.
Okay.
But
Yeah.
some people, call me the next day and they're like, "Man, game changer." And I was like, "Good for you. Good for you."
Awesome. Definitely. Yeah, that's good to hear. So you usually recommend, exercise. I would assume, if they have diabetes, they usually need to get that, a little bit more under control before they're going to get the most out of this.
Yeah, that's correct. Because the one of the most significant things from diabetes is vascular disease, and if you go along and you don't control your diabetes, then your vascular disease gets worse. Then it's really hard to correct ED.
Mm. Do you usually find if somebody's had diabetes for, a number of years and they get it under control that resolves the ED on its own, or is there usually some damage that's occurred that needs to be treated?
It's usually a mixed bag on really how long they've had it, how bad they've had it. In today's world, a lot of the people have sensors and pumps, and they're really controlling their diabetes very well. Somebody like that's going to get a much better response than somebody that has not had their glucose controlled over time.
Mm. Yeah, that makes sense. And I know we talked about kind of the presenting symptoms and, when somebody is struggling with ED, when do you feel like they should be, seeking professional help and trying to find this kind of treatment?
Just as soon as it impacts her life, because as soon as it affects you, it starts affecting your confidence. And if your confidence erodes, then you really have a bad problem. And so we want to stop that before your confidence really gets eroded down to nothing.
Definitely. Yeah, because I know if you have a physical issue, then you might start having kind of a mental block there too and being worried about it. And that's really not, the best recipe for what you want there.
No, it creates so much anxiety that some people will just avoid having sex altogether. That,
Mhm.
that's just a sad moment.
Yeah, definitely. Yeah, I would imagine once you, do a treatment like this and get some of that, physical ability back, that you're able to get them a lot more confident in their ability to perform, right?
That's correct. Yeah, we can start rebuilding their confidence.
Yeah, that's awesome to hear. And what would be the best way for patients to get in contact with you there if they wanted to come in for a consult?
You can go to Michael McKay, MD. That's one of our websites. Trillium has its own website and phone numbers, or you can find us on Facebook.
All right, awesome. And then, yeah, those are the most of the questions that I had for you. Was there any last advice or anything you wanted to leave the patients with if they're, struggling with ED, not sure what to do?
Just seek out help. Don't wait and let it get you down emotionally, psychologically, and physically. Please come see somebody to get intervention before it gets to that point.
Yeah, I definitely agree. I think with these treatments being out there, there's no reason for them to have to, suffer through this.
Right, right. Or be ashamed. It's just, it happens to all of us at some point.
Mhm. Definitely. Yeah, I know diabetes and things like that are talked about pretty openly. So I feel like ED should be one of those things that's able to be talked about as well.
Yep. Should be a little easier than it is.
Yeah, absolutely. All right. Well, yeah, thank you so much for taking the time to talk with us today and share the education on those treatments. I really do appreciate that.
All right. Have a good day.
Yeah, you as well, doctor. Thanks again.
All right.